Hi, Mark White here, president, founder of Idaho State Planning. I think that's right here behind us. And this is not the radio, but this is a podcast that we've continued with the Senior Matters Radio. And today we have a great guest, one of my favorite people.
You have to say that.
I do not have to say that. I say it because it's true.
Aw, thanks.
Kimberly Ouwehand, and I wrote this down so I would get it right. She is the Director of Strategic Partnerships for Terrace Home Care. And I promised you I would ask, what does that mean? Director of Strategic Partnerships.
It's basically business development, but my forte is connecting dots with other resources and moving healthcare basically in the right direction by strategically partnering with strategic partners.
So, well, and strategic, you
Yeah.
all know what that means, but typically that is you provide this and you interact with these folks that do this.
Yeah.
Right?
That-
Because none of us does everything.
No, right. And so the partnerships need to be somebody that moves in the same direction as you do.
Yeah.
That fills gaps that you can't get to. So it could be a payer source, it could be a provider, a doctor, it could be a community resource. But knowing that you need somebody and strategically partnering with them so that you're both winning in the same direction and going in the same direction.
Well, and the winner. The winner is you
That's right.
because we are
That's the
bringing
goal.
those resources together. And I'm going to say this probably a number of times. There are people that will be watching, at least 5 or 6 of you, 7 if mom's watching. And there are people that are just, I have to work this out myself. You know what, I've got to do this. And the short answer to that is, well, no, they don't. There are people that can help them.
It's a strategic partnership.
And that's what a strategic partnership is all about. I was coming back to it. Some of you are kids of parents that we'll get into this. You are the kids of parents who may need this type of help. So pay attention, write down a few notes. You can watch this over and over again. So let's talk about, because you gave me a great outline here for that. It's a fairly difficult and can be very strange, well, that's the word I'm looking for, stress-filled transition from, let's say, rehab to home, for those that want to go home. And we found more and more people want to go home. They want to be home. And the COVID thing, most people remember the COVID thing.
It will be in the history books.
Oh my gosh. But that really pushed a lot of people to go, I want to be in my home because I think I'm better protected. And we're all for people being at home. We just want to make sure that it is a quality situation for people.
Correct.
We want them to be safe and all that. But right now, let's talk about that situation that arises. It could be a fall. It could be...
Accident.
Yep, an accident. It could be a stroke or...
Heart attack.
Yes. These are tough things.
For sure.
The path usually goes through the hospital, and then they'll say, all right, we're gonna move you to skilled nursing or a rehab unit. We're going to get you pumped up and get you back to wherever we can get you back to. And then kick you loose. And it could be it could be independent living, it could be assisted living, it could be home. For those that want to go home, that's who we want to talk about particularly today. Well, walk us through a little bit of the process, because this is not I woke up on Thursday, I'm going home.
Right.
It doesn't work that way.
It's interesting. Most of these healthcare crises happen when you're not planning it. You're not really planning to,
No.
fall off the curb or get hit by a car, And so what happens is you end up in the hospital. They get you to a place where you can rehab, and then you go to the rehab. And rehab will often, they want to get you to a place where where you can safely move on. What's interesting is that with insurance companies or payment models, rehab sometimes has to discharge at a higher acuity.
Now, hold it just a second.
Yes.
I have no idea what you just said. What do you mean higher acuity?
Meaning that you're not fully 100% back where you
Where
started.
you'd like to be.
Yeah. Or you may have still
So you're
some
talking-
rehab that needs to be done in the home.
But it can be done
Yes.
elsewhere.
Mm-hmm.
So you're talking Medicare.
Yes, mostly.
Well, Medicare, the reason I say that is Medicare has some limits on how much it will pay for that rehab.
Exactly.
And you hear this from me, but there's some pressure on doctors to move you through. So that higher acuity thing that Kimberly's talking about is, you may not be where we would love you to be, but this is what we're doing now.
Exactly.
Okay.
Yeah.
All right, so talk to me then. How do we can't just send them home.
No.
Although they do.
They do sometimes. What happens is when they're rehabbing and then they need to, leave the rehab, assisted livings cost a lot of money because it's not covered by Medicare.
Yeah.
So families and patients can't afford it. And then they may be not at that level for actually skilled nursing placement or long term.
Okay, so
Yep,
just
long
take a-
term.
Yeah, let's take a step back. So, assisted living, I would bristle if I were in assisted living and somebody said, "Oh yeah, well that's non-skilled."
Yeah, me
Dang
too.
it takes a lot of skill.
Totally skilled. I don't like non-skilled. We're all skilled.
If we use the term non-medical, that would be a little bit more accurate. It's
Maybe.
not.
Yeah.
It's not non-skilled.
No,
So
it's
whatever you
skilled.
say.
Yeah.
But when we talk about skilled nursing, we're talking about we've moved up on the needs.
Correct.
It could be mostly physical, but it can be medical. Now we need a two-person assist to help with all that. Assisted living is quote unquote non-medical, but and it's expensive and it's not covered,
Right.
and that's a challenge right now for our good friends at assisted living. So that's just difficult right now. Although the state legislature gave them a little bit this time.
Yeah.
A little bit more money. We'll see how that works out. All right, so a long-term situation. That is assisted living. And if we just can't stay at that level, which can be a challenge,
Right.
then skilled nursing. If we can avoid skilled nursing, I love the folks at skilled nurse. They're sweet, wonderful people. But if we can avoid that, it's very expensive
It
right
is.
now.
It's expensive. It's covered by Medicaid.
Yeah.
So there is that, or as you know, long term. This is when I would talk to Mark right away because Mark knows. But yeah, it's more of a permanent. It's a more of a permanent place where your health is going to continue to stay at a high level of care, right?
Yeah. So, like I said, we have a bunch of clients that if it was a choice between assisted living and being at home, they would like to be at home.
Most people, yes.
Tell us, though, what it takes. How do we make this work?
So if a person wants to come home or needs to go home after rehab or an accident, we started a program that's a bridging program. It's a 3-day program, highly intensive, where we can meet the patient and the family at the time of discharge, go to their home, walk them into their home, get them settled. And what we found is that when they go back home, they're not at the same level that they were when they got there.
Yeah.
Or
This thing happened.
I know, and they weren't planning it. So, they maybe have gone for a walk, and what do you know? They had, laundry in the washer and the dryer, or they needed to take the garbage out, or there's all kinds of stuff.
In the fridge that maybe should have been taken out before they left.
Especially if they're living by themselves. And sometimes they'll have family members or a friend who can go in and kind of clean that out, or they may have a pet. That might be another issue too. So that
is now going crazy.
Yeah, and so they need somebody to take care of their pet. But they may stay in the hospital. Like we've transitioned people that have been in the hospital or rehab for 3 months or 4 months. So when they go home, all their food is rotten, or we had a lady that had a flood in her apartment, and all of her stuff was in a box, so we have to help her unpack. There's a lot of things that can happen in 4 months when you're in the hospital or in rehab. So we meet them at the time of discharge, and then we follow them home. We get them set up for that day, make sure that they can. The weird thing is, out of all of the activities of daily living, bathrooms are a huge deal. Most people can manage to get food or get into a place where they're comfortable, but bathroom situations are really hard. So we kind of work through some of those. Getting in their home, if they have stairs, sometimes is an issue.
Yeah, stairs, if you're getting to a certain age, and I won't tell you what that age is, although we got rid of stairs. Stairs are a major source of concern, if not for you personally, for your kids.
Right.
Can I just say that? It's never happened to me, but those stairs, oh my goodness.
And you're right, and I'm glad that you brought that up about your kids, because I think what my heart goes to is not so much the patient or the client, but it's about the family caregiver. It's about their support system, because your wife said this so well, is like, we've never done that before. So it's a whole new it's a whole new learning curve, and even as professionals, it's still overwhelming. But to have somebody who has done it, been there, seen a lot of different things, can problem solve along with the family members, gives them a lot of confidence and support for them to be able, and tools to be able to move forward to help their family member get home safely.
Well, I'll say this, you'll say it better, but I'll throw it out there. We all want to live at the lowest level of outside help. We all do.
Yes.
And we're not all really good at understanding what the lowest level that we need.
Right.
We may think it's clear down here. Kids might think it's right
Oh my goodness.
here.
Yeah, yeah.
And then professionals will go, we need to talk about that.
What we found is that bridge, during that time, that's when all of a sudden people are stopped in their tracks because they are going back home, and they're like, oh my word, I should have been planning ahead of time. I should have been putting these things in place. And then they're forced to also have those difficult decision making and different difficult conversations that bring you into a lot of estate planning, like, oh my goodness, what do I do? Who is the durable power of attorney, and what are my wishes? What happens if this happens again? And I know,
and they're all doing this now at the most stressful time to do all this.
Exactly, but it's the right time and the right place, and
it needs to happen.
Forced. Yeah, I think the hospitals always ask, do you have your living will, your durable power of attorney, and all of that in place, and they kind of meal piece it together, but they honestly don't have the time to sit down with the family and talk about it. And then also that person they're focused on getting home. They want to get out of the hospital.
Yes.
So they're not really wanting to look backwards. But when they get home and they've had a couple days to digest that, then they're like, okay, what can we do to plan that will not happen again, or it'll go more smoothly next time?
So it seems to me there's two things that need to be worked out. One is we need them in a safe, comfortable, I like to throw in quality, situation.
Absolutely, quality.
And then we also need to, and that's short term. That's today,
Absolutely.
that's tomorrow, that's this week. And then we want what you just said. We need to also plan or do whatever we can to avoid this happening again.
Right.
And you stated it well. We need some professional hand holding
For
for
sure.
the most part.
Yeah.
All right, you tracking so far?
It's a lot of information.
That's a lot of stuff.
It is.
But let's review what got us here. Some sort of an accident, a health crisis in the home. We might have the 1970s thick pile shag carpet.
Narrow hallways.
With a narrow hallway, no handrails. We haven't gone through and done a real assessment and an upgrade. And then we go into the bathroom, and again we haven't upgraded that to help us to stand up to get out of a tub. Oh my gosh. You know, I was in a hotel back in Detroit a couple of years ago, and I was getting in for a shower, and that I don't know if they left a little soap or something in that. I hit that, and I didn't go all the way down, but I was sitting there thinking other people would go all the way down. I went down far enough. It was not good. I let them know at the front desk that this was not a good situation. And so now anytime I stay in a hotel, I'm looking for that little mat that you put in there. Oh my gosh. So people don't, you don't think about that. You just don't.
Well, and bathrooms in the older homes were really tiny too. So how do you get in and maneuver to the toilet versus the bathtub safely?
You have to figure that out before you go in, because there's not enough room to change your mind.
Right. And do you get two people in there to help you do that? Like, then it's real cozy.
Yeah. Well, and so we work with some absolutely lovely, wonderful people, the kids, that want to help out.
Right.
And of course, the women have a better handle. The men are just kind of, well, we can do that. We can help out. Your mom is not going to let you help her bathe or go to the bathroom. Period. End of statement.
Well, it's uncomfortable for them too, the boys.
I know. And so, I can make this happen. No, you can't. All right? Take it from me. No, that isn't going to work. So that's a source of an issue. We could have a fall. We can have a medical issue. We're moved into the hospital. I don't know very many people that like to be in the hospital.
No. I wanted to be in the hospital for a little while just to get a break. So I could watch TV for 24/7.
We have 6 kids, and it was great. We were fine with the hospital, and they were lovely, wonderful people, and it was great. And my wife was okay taking a break, but they won't let you sleep.
That's true. Buzzers.
Every time you fall asleep, they come in. We got to check your vitals and blah 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 blah. And so 2 things. My wife wanted pizza.
Oh.
So I bring in pizza.
You're a good husband.
And she wanted to go home so she could sleep. And
That's true.
more often than not, her mom was there, and her mom was the baby whisperer. And so we could go home, and Elaine just took over, and my wife got to sleep a little bit. So not thrilled with hospitals. My father-in-law, by the way, would not go into hospitals. He did not like them.
There are people like that.
He
for
just,
sure.
oh my gosh, he ended up in the hospital, and it just wasn't, it wasn't good. So people don't want to be there. They want to move out as quickly as possible. And so the hospital also wants you to move out as quickly as possible. And then if the hospital doesn't, you do. Well, I want to move out. And typically, Not always, I suppose, but typically we're moving into a rehab situation.
Right. It's about a 23-day stay, approximately 20 to
Is that
23.
right?
Yeah. If you have really good insurance. Sometimes it's shorter, you know. There's a lot of little nuances that go in with
we
that.
mentioned
Yeah.
that there's pressure from payors, your insurance and Medicare, to move that along. And so home being probably the number one target.
Right.
Maybe doesn't always work that way, but it's the number one target.
It is. Everybody wants to go home.
Okay. So you talk about a transition that starts as we're moving home. It wouldn't hurt to start sooner than that.
Well, usually, I think what you're asking is that when we know somebody's getting transferred, is going home, we like to have the case manager, call. Or usually it's the case manager will call and say, hey, we think we have somebody who would be interested in it. And then we can meet with them and their family where they're at, whether that's hospital or rehab. We can tell them about the services. We can talk about what some of the things that they're concerned about, what their goals are, and then we can align ourselves with what they need. Sometimes we actually will go to the home before they get home to actually look at it, like in person. And then we can make adjustments that way. And then the program actually starts the day they get discharged.
Got it. So it would be good to maybe at least visit as we're anticipating the move home. But then it starts in earnest when they get home.
Exactly.
Okay.
Perfectly good.
Now, I've looked at your outline, the Terrace Home Care outline, the transition to home. I imagine that I won't say competitors, your compatriots out there have a similar idea. I like hers. It's really well defined. She did a good job. I'm going to put a star at the top because it's really good. But whether you call up Terrace Home Care or someone else, these are steps that need to happen.
Correct.
It's nice if it's really organized because mom might not fully appreciate it. Most of them would, I think. But those that are on her team, you know, the family members, it is so nice to know.
Right.
Okay, so I'm going to tell you a quick story about Kimberly.
Oh, dear.
My pen quit working. I threw it over and it didn't land in the trash can. I was fine leaving it on the floor till later. Kimberly could not. So as a daughter, she would like to know everything. We've got a plan, and this is how it looks. And understanding that, you know, there are things that may change, but you and many daughters like to know, oh, you've got a plan. I love it. This is great. And we didn't have to come up with it all on our own because you've done the homework. I like that. And so I'm just suggesting we need the family. We need the team. We need the people on our team. But this is a situation where a professional on the team can make it easier.
Right. We're an expert.
Yes.
You know, just like when I'm talking about, you know, estate planning, I am not an expert. I need somebody like you who knows everything so well, that knows the pitfalls and things that I need to be watching for. And especially under crisis mode, like I'm going to come to somebody like you, I'm going to be all set up. I know you have a control. When I hit crisis mode, I'm going to call you right away because you know how to take care of me. You know, I don't have to think about it. I'm like, I love that. It's worth every moment that I spent pre-planning.
We've
Just
been
saying.
there. We've seen a ton of stuff. Just like you, we haven't seen everything.
Nope.
You haven't seen everything.
No, never. Yeah, you're always learning.
And people are different.
That's right.
You're gonna have the little guy who's cranky, doesn't know why you need to be there, and is yelling at the kids,
Absolutely.
going, "Why is she
I
here?
know,
I don't even know why. We don't."
I know.
And then you're going to have the lovely lady like my mom who's going to give you a hug and say thank you.
Thank you so much for being here. You're like, yeah.
And that is different every time.
Every
right?
time.
This is personalities and families and all that. And within the family, you're going to have, I don't know if it's the son, but someone who's cranky. We can take care of this. We don't need her here.
It can be a mother and daughter. We've had that before.
Very
you
good.
just can't be perfect enough for them. So you're just like, we're trying.
Yes. So let me ask you a question, because we try so very hard to help people before they need it, right? We want to get some things set up. We would like to have these things in place. A plan, right? We'd like to have a plan in place. Is this something that someone could, out of the blue, call you and go, I think I'm feeling good, health-wise, doing all right, but I know I've got this issue and possibly this issue. Can you come to the house and visit with me, and we'll do a little pre-planning?
Yeah, I haven't gotten that far yet, but that's a great idea to come and just do an
All right,
assessment.
I just need a
Sure.
little commission every time you do
Okay,
that. Just
yeah.
write me a check.
We'll
and-
talk afterwards.
There we go.
Strategic partnership right there.
Strategic right there. Well, it seems to me that this is a situation that is just stressful enough that I was talking about my wife going to the hospital. I mean, we have the bag packed, right?
Well-
and here's what needs to happen. We get she wakes me up and says, I think it's time.
Yeah.
Okay, we're going.
That's the thing that's so my background is in hospice, and so it's always been very interesting to me. Like, end of life and the beginning of life are very, very similar. Like, I mean, you still need, you don't need a stroller, but you need a walker. You need maybe a hospital bed versus a crib. You may need, a wheelchair. And we don't tend to spend time planning for that. Like, when you're pregnant, you have 9 months.
You do.
It's sometimes harder when you're at end of life to be knowing you have 9 months. But the thing is that this is the beginning step of when you're in crisis. That's when you are the most open to, let's start planning, let's start getting things in place, and then just supporting the family caregiver. I feel with healthcare moving in this value-based health model, more and more people are going to be going back home.
Yeah.
And I feel like, America's unique in that we don't have a family unit. Our family units are spread all over the country.
Yes.
And so
I would guess at least 2, maybe 3 time zones.
I think, sometimes that.
That's mine.
And even if it's in the same time zone and you're in the same state, we're so crazy busy. And
Yeah,
you've
that's
got
true.
that, the sandwich generation, where you've
I'm
got.
the baloney in the
I
sandwich.
heard that. I love that. Yeah. I think I might be mayonnaise. I'm not sure.
The lettuce.
The lettuce,
There we go.
lettuce.
But not the dill pickle.
No, well, I like dill pickles, so.
You and my wife.
I know.
It's like, do you need a dill pickle on that?
Yeah.
Put it on the side.
Oh, yeah.
Yeah.
But I think this is so when I looked at the transitioning part of people, and part of Terrace Health also has home health. And so what was happening was I was hearing patients were getting discharged, but when they discharged, they said, they have home health, they'll be taken care of. But what people don't understand is it takes a couple days for home health to get set up once they're discharged. It's not like hospice where you're immediate.
Right.
It's more of like you've got to get doctor's orders, you got to make sure everything aligns with all of the regulations that are attached to to home health. And so it sometimes takes a couple days. So in between, people are thinking, I've got people coming in to see me, but it's 3 days. And those 3 days, there's a lot happening.
Oh, yeah. And what is home health going to find after 3 days?
Exactly.
Right?
Yeah.
They're not walking into an optimal situation. They're just walking in going, okay, and that's not That's not their area.
Right.
Not-
Their area really is very specific.
Yes.
It's a therapy. So for the therapist, they have a specific goal in mind, whether that's getting your muscle strength up, whether that is attending to a wound, whether that is maybe whether
That's easy for you to
yeah,
say.
I know. Whether that's med management or
Yes.
reconciliation and their homes. There's a specific goal and then once they meet that, then they're gone. This transition to home is more of a bridger that can kind of look at the whole picture and see all the players together and then explain to them, okay, this is the game plan. Your home health is coming in on, Tuesday, and they're going to do the assessment, and then they're going to come up with a care plan. So you're not actually getting the care right out of the gate.
Yeah.
Or there's been several times where they've gotten home and they realize they've had conversations before about maybe hospice might be the appropriate care for them. But when they get home, they're all of a sudden saying, I see this now. All of a sudden they're a little more accepting of it, especially if they can have that higher level of care brought to their home. And so we can then do the appropriate assessment and we can do the appropriate, what's the word I want?
Well, I liked assessment.
Yeah.
And then you've got to match it up, though. So you go in,
Right.
you're going to do the assessment. You're going to say, okay, we need this, 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 and this. And then you have strategic partners, actually, that you
That's
can
right.
work with.
Yep.
And so...
And refer to hospice and get hospice started.
Correct. The key, and I think this is, people get a little lost in this, the key is to get mom or dad in the best situation
Right.
possible.
Right.
And that's why I say quality sometimes.
Absolutely.
Had a friend, you probably saw this. I have a friend, she's passed now, but her assisted living, she stayed at home. She had a big 65-inch TV.
Mm-hmm.
She had a recliner that she sat in front of that. She had the Afghan over her leg, and that's what she did all day.
Mm-hmm.
And to me, that's not a high quality life.
Mm-hmm.
I'm not sure it was for her either, but
Mm-hmm.
she's very stubborn.
Mm-hmm.
And so there's a lot to this. And it seems to me it'd be helpful to have somebody who can come in,
Mm-hmm.
get an eye on everything, and go, your refrigerator isn't working.
And that's
Oh.
happened.
I just made that up.
I know, it's
wasn't
happened. I
anticipating
mean,
that.
you'd be surprised. when
Oh,
you find-
goodness gracious. Anyhow, so it would be great to have somebody who can come in. Now, I was talking a minute ago, can you do this ahead of time? Well, there's a lot you can do ahead of time. But there's also a ton that you can't do ahead of time. You
Well,
don't know until you get in.
Yeah, exactly. So when a person gets home, then all of a sudden there's these little things like their favorite chair that they really loved is too low
gonna
and they
work.
can't get out
Yeah.
of the chair. So then we either, we can refer to getting a lift chair at the moment, or if we get a higher chair, or we put pillows, or we do some kind of an adjustment. And there's other little things like if you go home in a wheelchair, can you reach the top shelf to get your food or your dishes any longer? So maybe we need to bring them down. There's a lot of little tiny little fixes that we can do right out of the gate that make it more successful for people to stay at home.
Which, because you've been around the block several dozen, hundreds times, you can see those easily, quickly. And the kids, they should appreciate that. Most
They
of them,
do.
I think, do.
They do.
But they walk in and go, oh, I hadn't even thought of that.
Yeah.
Hadn't thought of that. Hadn't thought of that. Well, I was wondering about that. And so somebody that can bring that
Right.
around.
And then also the other thing that we can do too is it's a team. So there's like right now it's me, and then a CNA, a really good CNA, who can actually help the caregiver training. So like if a person is bedbound, how do you change them? How do you roll them over safely? And she can show exactly how to do it safely and appropriately so they don't get hurt. And even we have an example of a gentleman who was taking care of his wife who was bedbound, and he knew how to take care of her, but she had broken her arm.
Oh.
And so then how do you turn somebody with a broken arm? And it was terrifying for him. And so to have somebody come in and kind of show, okay, this is what you do, maybe get another piece of, like a drop, I don't even know what she calls it, but some special cloth that can help transfer and all of that
very
stuff.
good.
So there's these little tiny things that you can do. And it's very innovative out there, and there's more equipment and more little doodads in, that you can get off of Amazon and Walmart and other places that will really, they're little things, but they can help you a ton. It's like cooking, you have to have that special tool. It makes a difference.
Well, so let's go to cooking for a second.
Yeah.
Okay. You can do all the reading you want about cooking, right? If it's a hobby, you will love it. You'll read all this stuff, and then you're going to try it, and you learn by experience.
Absolutely.
Rarely do you pick up
Exactly.
a recipe and make it perfect the first time.
Right.
Well, my oven's a little bit different, the top burning is, so it took me 3 or 4 tries, right?
Yes.
Working with mom or dad, it's the same thing. How long have you been in the business?
Well, I've been in the home community-based healthcare system 13 years now.
Okay, so in 13 years, have you seen, any of these situations?
Oh, no, never.
And so how do you know all this stuff? Because you've been there.
Right.
You've done it. As the son, this is not what I do. No. I don't read about it. I don't try to do this stuff like recipes. And that's how you learn, by the way. There is no substitute for experience. And so a family could try to do all this while I was reading. I was on, I looked on interwebs, and here's what or they could.
I think too the real value is, healthcare does a lot of managing via, phone or maybe appointments in the office or maybe Zoom. But to have a physical person go in and actually help you is very, very powerful. And it also makes very, very strong relationships and trust. So if you can build that trust with that person, then you can help them reconnect to those phone calls or, telehealth even, and just to kind of think through things. Because when you get discharged from the hospital or rehab, sometimes, they say, well, we can provide telehealth for you. And they show you how to do it. But then when you get home, it's in a different environment. You're in a different situation where in the hospital or in rehab, everything's there that they need.
Correct.
At the right place.
With the right people.
But all of a sudden, maybe you need, I don't know, like a Band-Aid or something, but it's all across the, it's in the bathroom and you have to get yourself over there. But having somebody there and kind of assess it, they're going to say, you're going to need those next to you, so let's move those next to you. And going back to telehealth even is that because you're in a different environment, you don't automatically think, my oxygen level is low, I need to connect with my telehealth, connection. They call me and say, my oxygen's low. And I said, well, have you reconnected to your telehealth? You need to connect back to your telehealth. Or, something's happening and my blood pressure is going up. And I'm like, have you called your primary care doctor? I mean, to me, they're simple things, but when you've done this, stressed, and they know that I'm the person that they can go to that will help them. So that's kind of where that trust, and I think that's where the power of it comes.
Oh, absolutely. I love it. All right, tell us a little bit more about Terrace Home Care.
Okay, Terrace Home Care is a department of Terrace Health, and Terrace Health has home care, PDN services, so that's private duty nursing. We have home health and soon to have hospice, and then we also have a sister rehab here in the Valley. And so it's a full continuum of care, which I have really loved. I think personal care services and home care has gotten much more sophisticated, and there's so much opportunity for growth and to really make a difference in value-based healthcare, keeping healthcare costs low, and still very much keeping the quality of life for people. So that's a department of healthcare that is growing, and I'm really excited for. I love our department at Terrace Home Care.
Awesome.
But it is under Terrace Health as a full continuum of care.
Well, how would we get hold of you?
You can call me, or you can visit our website. It's at Terrace Health, and then you just look for Boise. We have a couple of companies in Missouri as well. And
Boise, Missouri.
Boise. I know.
No, I can't see.
Kind of random. I know. I'm not sure how that happened. But yeah.
I know a connection. Are you ready?
Yeah. Oh, call Mark. Mark can get me to
That's
me.
True.
You can call Mark.
So Kansas City has some of the best barbecue.
I know they do.
And here in the Valley, we have great barbecue.
Mm-hmm.
Some of our barbecue people have gone to those contests
I
and
know.
won. So
Yes.
there you go. There's the connection
That
between
barbecue. It's all about the sauce. Well, there's more than that.
Well, you got to smoke it.
Yeah, you gotta have the right. Yeah, there's a lot of stuff going on.
Anyhow.
Yeah.
All right. So give us a phone number.
You can call 208, and then I don't know what the office phone. Okay, you can call 208-506-7200, and if you're specifically interested in the transition to home program, you need to tell the person that answers the phone, the receptionist there, that you're.
Okay. Transition to home.
Yep.
Now again, I'm not getting paid. I should. Maybe I'll get some bodacious pig out of this. But
Ooh.
the transition to
Sounds
home program is very well thought out, and we've talked. The concept is to move from where you have everybody there doing everything at the hospital or rehab to at home. Or it's a whole different environment, right? There's not everybody there doing everything. And so Kimberly has worked hard to outline a process for doing that. And it's really well done. You need to call. Again, that was 208-506-7200.
Oh, I like that better.
Well, that's how my brain works.
Yeah,
I'm sorry.
7200.
That's how that's 506-7200. And ask specifically about the transition to home. If you have questions, ask. And if you have the right questions, they'll connect you to Kimberly. And if you didn't catch any of that, give us a call. We'll connect you. You know, we just want you to be well, be able to take care of each other. We want people to be safe at home. We want them to be comfortable. We want a quality of life.
Mm-hmm.
We want the friends to be able to come over and say,
Mm-hmm.
hey, how are you doing? All of that. And so, thank you, Kimberly. Appreciate that.
Thank you so much, Mark.
You're one of the ones that's out there everywhere trying to get people to think through this and to help them when that situation arises. And it's lovely, wonderful.
Mm-hmm.
So I recommend it strongly. And that's it. I think that's
Thank
all
you.
we got for
Yeah,
today.
I love it. Thank you.
Thank you, thank you, thank you. All right, we'll catch up with you again here on the Senior Matters Radio podcast. Take care.
Bye, everybody.